Hi, I'm Dr. Rhonda Johnson. Now, whenever I'm hit with really distressing news, especially when it involves one of my grown children, I get this sudden, overwhelming urge to use the bathroom. Has that ever happened to you? Well, today is Friday, May 30th, 2025, and as we close out May as Mental Health Awareness Month, I want to talk about the powerful connection between your gut and your brain. See, your gut is more than just a place where food gets digested. It's a complex ecosystem, home to trillions of microbes, what we call the gut microbiome. Now, these microbes play a key role in our nervous system, and they communicate with your brain through a system known as the gut-brain axis, a two-way communication highway between your brain and your digestive system. Did you know that? So here's some fascinating science. Your gut produces about 90% of your serotonin, a neurochemical that can affect your mood, sleep, and your pain. Specialized cells in your gut called enteroendocrine cells release serotonin, dopamine, and even GABA, which helps calm the nervous system. Now, this constant back and forth communication is carried by the vagus nerve, which sends signals between your gut and your brain in both directions. Now, doctors use the term disorders of gut-brain interaction, or DGBIS, to describe certain conditions that arise when this communication goes wrong. These used to be called functional GI disorders. Examples include irritable bowel syndrome, reflux hypersensitivity, or functional dyspepsia, a type of chronic indigestion. Now, DGBIs happen when signals between your brain and gut get mixed up, and that can cause abdominal pain, bloating, nausea, urgency, feeling like you have to go right away, or even changes in your bowel habits, even if routine medical tests come back normal. So how are DGBIs treated? Well, there's no one single solution, but some strategies that can help include lifestyle changes like eating balanced meals, managing stress, and limiting highly processed or greasy foods, avoiding excessive alcohol because that can irritate the gut lining and disrupt healthy gut bacteria and worsen symptoms. Now, medications like the ones used for depression, anxiety, or nerve pain can help. And then there's dietary support, eating more prebiotic-rich foods like garlic, onions, oats, bananas, fermented foods, and beans. And then it's important to limit unnecessary antibiotics because they can disrupt your gut ecosystem. And then there's alternative therapies, could be herbal supplements, acupuncture, ginger, or turmeric. But check with your doctor first. And lastly, there's gut-directed therapy with a counselor or psychologist can help reduce anxiety that is focused on your GI symptoms. Many people need a combination of these approaches to feel better. So if you're regularly dealing with those gut symptoms, especially if they get worse with stress, you may have a DGBI. So talk to your doctor. Tell them how it's impacting your life, whether you're missing work, skipping meals, or constantly needing to be near a bathroom. These conditions are real, folks. They are not just in your head. And with the right care, you can feel better. That's my message today. Take care and be well.